بسم الله الرحمن الرحيم. طلبة المرحلة الثانية كلية الطب. The second lecture in osteology of the head, we talk about the lateral view of the skull. From lateral side, we can see the following structure. We can see part from the squamous part of the frontal bone, part of parietal bone, squamous part of the temporal, mastoid process of the temporal, tympanic plate, and styloid process. In addition, we can see the greater wing of the sphenoid bone, part of the zygoma and ramus of the mandible. In addition, the inferior and part from the body of the mandible. In addition, part from the squamous part of the occipital bone. In the lateral side, we can see the most important area, which is the result from the joint of the four bones, named the Baturian area. This is H-shaped area in the lateral side of the skull, composed of from the joint or union the following bone: parietal, frontal, greater wing of the sphenoid, and squamous part of the temporal bone. This area, it has a clinical importance. The clinical importance because it's overlying the most important structure named the middle meningeal artery. The middle meningeal artery is a branch from the maxillary artery which supply the meninges of the brain. In addition, these bones represent the floor of the temporal fossa. In the temporal region in the side of the lateral side of the skull, composed from the temporal fossa, and below the inferior border of the zygomatic arch, behind the ramus of the mandible. Here we can see the infratemporal fossa, and this structure we can discuss in detail later on. Now the temporal bone composed from the following parts: the squamous part, C-shaped tympanic plate, which represent the bony part, external bony part of the external auditory canal, part of them of the external ears, and mastoid process. Inside the mastoid process, there is many mastoid air sinuses, and the styloid process, the third part. Now squamous, tympanic plate, mastoid, and styloid process, and intracranially from inside the petrous bone. بالعربي العظم الصخري. البتروس bone house for occupying the structures of the middle and internal ear. We can see intracranially. An interior surface of the buttress bone, we can see slightly elevation, thin bone, named the arcuate eminence. This is the arcuate eminence, thin bone overlying the superior semicircular canal of the internal ear, arcuate eminence. So the arcuate eminence, thin bone overlying the superior semicircular canal of the internal ear. And this is the structure of the internal ear. This is superior, inferior, and posterior, and this structure of the middle ear. So this structure of the middle and internal ear located inside the petrous bone. This is the petrous bone. Posteriorly perforated by foramen, named the internal acoustic meatus, and this foramen for transmission of the seventh and the eighth cranial nerve, named the seventh cranial nerve, facial nerve, and the eighth cranial nerve, vestibulo-cochlear nerve, عصب السمع والتوازن. Now, this is the C-shaped tympanic plate. We have also structure between the squamous and the tympanic, named the squamo-tympanic fissure, and this fissure for transmitted branch from the facial nerve, named the chorda tympani. The chorda tympani branch from the facial nerve joint the lingual nerve, a branch from the mandibular nerve to supply interior 2/3 of the tongue. So the chorda tympani supply the interior 2/3 named to supply the taste bud، يعني العصب المسؤول عن الحواس الذوق اللي هي الأشياء الحلوة، الأشياء المرة، وهكذا. هاي مسؤول عنها الكوردا تمباني. While the sensory innervation of interior 2/3 of the tongue supplied by the lingual nerve, which is a branch from the branch from the mandibular nerve. Also in the lateral side, we can see two lines. This is the inferior line and this is the superior line, named the superior temporal and inferior temporal line, started at the single line and then separated and end in the posterior end of the temporal fossa. The superior temporal line give attachment for the temporal fascia, while the inferior temporal line give attachment or origin for the temporalis muscle. So in the lateral side, in the temporal region, here, the temporal fossa started or the boundary superiorly by inferior temporal line and end at the inferior border of the zygomatic arch or infratemporal crest of the greater wing of the sphenoid. And inside this fossa, we have many structures we can discuss later on in detail. And this is the infratemporal fossa. Infratemporal fossa, here, the infratemporal fossa below the inferior border of the zygomatic arch, this area, infratemporal fossa, located below the infratemporal crest of greater wing of the sphenoid. Also, the infratemporal fossa communicated through the fissure with the pterygopalatine fossa. This is pyramidal in shape, small in shape, located below the orbit, behind the maxilla. This is named pterygomaxillary fissure. This fissure communicated the pterygomaxillary fossa with the infratemporal fossa. Also, we can discuss in detail the structure inside each the fossa. The Peterion area now as shape, as we said, articulation between the frontal bone, parietal, greater wing of the sphenoid, and squamous part of the temporal bone. Asterion meeting area of occipital, parietal, and temporal bone. This is the asterion area. This is the parietal, occipital, and this area related to the temporal bone. Now the posterior view of the skull. From posterior view, we can see the following: mainly posterior view, the squamous part of the occipital bone, and part from the squamous part of the parietal, and the joint area, and this is the fibrous joint, named the lambdoid suture. So the lambdoid suture is the joint area between the two parietal bone with the occipital bone. The suture between both parietal bone named the sagittal suture. This is the sagittal suture between two parietal, and this is the lambdoid suture between the both parietal and occipital bone. In the posterior area, mainly we can see also slightly elevation or protuberance named the external occipital protuberance and external occipital crest. We can see also the superior nuchal line and inferior nuchal line, and this line for attachment of the muscles, deep cervical muscle, in addition to the ligament. So in the posterior area, we can see the lambdoid suture, mainly external occipital protuberance, external occipital crest, in addition to the external and superior nuchal line and inferior nuchal line. This is external, posterior view of the skull. The superior view of the skull, we can see mainly the both parietal bone joined together by the sagittal suture. In addition, articulation with the both bone with the frontal bone by coronoid suture, and joint both bone with the occipital through the lambdoid suture. And finally, thank you very much.